In Eastern Uganda, a growing number of women are silently enduring years of pain from a treatable condition, pelvic organ prolapse.
Pelvic organ prolapse is basically organs that are in your pelvis coming out through your vagina or basically throughout your private parts. And mainly it is the uterus, the urinary bladder, and the rectum that normally protrudes out.
We found Katrina Kwagala at St. Francis Healthcare Services Hospital in Injeru moments after a post-surgery review. She has lived with the condition for over a decade.
The problem started after I gave birth to my third born in 1996. I used to tell my husband that I am not well, but he did not mind until the doctors told me that I would die if I did not stop having children, and that was after the 6th child.
Kwagala says the condition is deeply stigmatized, often isolating women and in some cases breaking families apart.
When we told the other women to come for treatment, they told us that they were going to die due to surgery. At one hospital, I was told to pay 300,000, which we could not raise. When I told my husband, he just looked at me.
But why are so many women living with a condition that can be repaired?
Ignorance to a bit of illiteracy, and I don't want to believe illiteracy should actually be a big driver for poor health outcomes. But also I think there's not been enough awareness within the community.
At Njeru's St. Francis Hospital, a team of trained medical professionals is now offering corrective surgery through a specialized medical camp.
And the reason why we actually decided to have the Prolapse project is that in the process of screening for cervical cancer within our services, we discovered that we're seeing a lot of prolapse cases. And what we decided was to explore how to address this issue.
Doctors say they are now receiving an increasing number of young and middle-aged women, especially after announcing free treatment under a one-year outreach program.
The project here started in July last year, and so far we worked on about 180 mothers.
That opportunity drew women like Kwagala, who traveled over 30 kilometers from Buwenge in Jinja to access care here.
The technique called sacrospinous fixation. And in this sense, the option is not to take out the uterus, but to suspend the uterus on ligaments. Now, we are so lucky that we got trainers from Australia who have done this with Kitovu Hospital. And they have managed to train 3 of our doctors. But I think countrywide, from what I hear and the numbers that I get from the reports, there are probably about 12 to 15 doctors within Uganda that have been trained by one Australian doctor called Dr. Barbara Hall.
Despite its impact, pelvic organ prolapse remains largely undocumented, leaving many affected women invisible within government health programs.
Giving birth to quite a number of children, and we've noticed that most of our mothers have 7+ children. So it's the commonest risk factor, though there are other risk factors like leaving little space in between children, small interpregnancy spaces, that also predisposes. Then there is age. Age is also a common risk factor.
And what we're advocating for is that if there are opportunities to pick some of these doctors who have already been trained, to take them to especially referral hospitals, because up to now we still get cases from referral hospitals referred here because we are part of the few hospitals in Eastern Uganda, if not the only one, that are working on prolapse cases without removing uteruses.
In private facilities, the cost of surgery can exceed 2 million shillings, putting it out of reach for many.
It's a very common condition, mainly in Busoga region, and I can attest we worked on quite a number of mothers with the problem, and What makes it so touching is that it's a neglected condition. It's a devastating condition, and when you notice, most of the mothers that have this condition are single parents. The husband left because the husbands can no longer support a woman who is not giving them what they normally want, the sex part, the sexual life, and most of them are not sexually active.
Health experts, however, maintain that the condition is largely preventable.
Have a few children, and those that really want to have quite a number of children, we tell them at least leave enough space in between the births so that your body recovers fully. The other thing we encourage is delivering from hospital, because one of the risk factors is also obstructed labor.
With the growing awareness and targeted interventions, there is renewed hope that no woman should have to live with a condition that is both preventable and treatable. Walter Mwesije, NTV.